we're going to start with what we're considering a modified poster session. So you're going to go out these doors, make a right, and then a left. And there will be 4 stations where people are going to be presenting some, we're calling showcasing some things that are possible. We're going to look at things that have happened over the course of the past decade. And so we're asking you to self-select yourself roughly into about the same size groups, roughly 10 people each if you're here physically. The folks online, Fisher is going to carry the laptop and make sure that they get a chance to visit all the stations. You're going to spend roughly 15 minutes at each station. We're going to encourage you to move to the next station when we get to the end of that 15 minutes. I think we may have a bell or, I don't know, we'll play Mary J. Blige again, some way to let you know that it's time to go to the next station. And you will have a chance to visit all 4 stations. So again, you want to self-select yourself in the groups, roughly 10 people each. You're going to spend about 15 minutes at each station. The speakers at each station are going to spend a little time describing their topic and then ultimately get into a conversation and dialogue. We want you to not just hear about what they have done, but ask questions that help you get clearer about how you might apply some of their learning to your own context. So let's think about how we might be able to apply some of the good things they have done to where we are already doing our work. Okay, so that is the plan. These are the 4 stations. We're going to hear about the social safety net from Aparna Mathur, who is senior fellow at Harvard Kennedy School. A second one of the showcases will be Lindsay Morgan Tracy and another group of folks. She is the innovator-in-chief for the Department of Social and Health Services in the state of Washington. And they're going to be talking about building political will for generational justice, joy, and well-being in Washington state. I'm going to say that again because they really worked on that title. It's very impressive. Building political will for generational justice, joy, and well-being in Washington state. Sue Polis, Director of Health and Well-being, and also with the National League of Cities, Deputy Mayor, I got both of these things, in Tacoma, Washington, are going to talk about cities of opportunity. And then we're going to hear about a holistic and intersectional approach from Dorian Mason, Director of Health Equity and Reproductive Rights and Health at National Women's Law Center. So those are the 4. You will get to hear from all 4 of them. Again, make your way through here, make a right, make a left, follow the people, and then again, we're encouraging you to get into groups roughly 10 each, and we'll help you know when the 15 minutes has gone in order to change to the next place. Is the task clear? Yeah. Yes, awesome, okay, go for it. And like I said, we'll let you know when 15 minutes has come.
I was just listening to Dave in the last panel, and so much of what you said resonated with the stuff that I'm doing at the Kennedy School. So let me back up a little. A lot of my research has looked at the role of tax credit programs like the child tax credit, the earned income tax credit, the role of CTC during the pandemic, the effect it had on health outcomes, poverty outcomes, and so on. And sort of even prior to the pandemic, sort of saying, well, how well do our safety net programs really work? And the way we link it to this setting is that we understand that a lot of these programs actually have longer term impacts on health and economic outcomes for families. So, it's not delinked from the supports. We tend to think of healthcare supports as coming in the form of Medicaid or, actual public health facilities, but actually a lot of the healthcare supports come through basic tax credit programs. So if you look at the research around the earned income tax credit, around food stamps, we know that having access to these programs early for families when they have younger kids actually leads to much better longer term outcomes for families and for the children growing up in these families. But a lot of my research also suggests that families have a lot of trouble getting access to these programs. And that happens because eligibility rules vary a lot across states. These are not combined into one sort of, what I like to call a one-stop shop, right? If you want to apply for SNAP, there's a different application form. You have to provide information on income and assets. If you want to apply for TANF, which is the Temporary Assistance for Needy Families programs, which is cash welfare, again, some states will say you need to actually go to a welfare office. Some states will say, okay, maybe you can apply online, but send us this paperwork. I actually had some of my RAs at the Kennedy School say, well, if you lost your job, right, where would you think of going to get help? And even finding sort of information on unemployment insurance, what do I need to do? How do I access the website? It all becomes really hard. So my research, which I started to do, sort of looked at a household survey, the survey of income and program participation. And we said, we think of the safety net as this, broad area. We spend about $1 trillion or at least $800 billion a year through a mix of different programs targeted at food and housing and health and cash. But how many people actually take up multiple programs, right? And the way researchers typically approach this is, okay, someone's working on SNAP and, they have a lot of information about SNAP, and someone's working on TANF. But, no one sort of looked at how many people actually think of the safety net as this net, which covers, 25 different programs that I can apply to. And the surprising finding is that about 130% people with 130% of below 130% of the federal poverty line, only about 33% say that we access more than one program. And about 38% say that we don't access any of, so we made a list of about 12 big programs, which we think, really matter for people in poverty. And about 38% said we don't actually access any of these. Now, caveat that with these are household surveys, so we understand that there's underreporting. People may not always remember that, oh, I took this up, the state helped me with this program, or I did access food benefits, or I did X, Y, and Z. But it's a surprisingly big number. And even if we correct for underreporting, it's a really stark finding that what we think of as a safety net is probably a few people taking advantage of one or two programs. So how do we fix something like the traditional safety net? And this is something that also struck me during the pandemic. I was actually working at the White House as a senior economist in the Council of Economic Advisors in March 2020, when everything started and government was like, no, we're scrambling, we have to get cash out the door, we need to get benefits in. And the first thing that every policymaker said was, we need to get cash out the door. So it wasn't as if we said, oh, we have this amazing, safety net and let's ramp it up. And, we did that, SNAP benefits went up, TANF went up. But that wasn't the immediate thing that people jumped to, right? We jumped to things that we don't do in normal times, which is let's get people cash because we understand that there's a price for it. And if we force people to go through eligibility and applications, then you're not going to get money out the door very quickly. And we also cannot target very well. So immediately, the economic impact payments went up. The second thing that I've researched also is the role of, paid sick days and paid family and medical leave. Again, no federal program on the books, but during the health crisis, we suddenly realized, well, if we have all these people coming in who are sick, then we're going to have, it's going to ramp up much faster than what we're currently seeing. So we suddenly had, that businesses with fewer than 500 employees were suddenly had to provide paid sick days and paid medical leave to their employees, and they could be reimbursed by the federal government. And I think the third thing was that the government actually made an effort to find people and give them the support that they needed, right? This is also not typical of what we see during normal times. The onus is always on the person who's going through the crisis to actually try and figure out, well, how do I get help from the government? So we made it really easy. We said, oh, we need bank account information. If you don't have bank account information, give us some way that you connect with the government and we'll send you cash. So I think there are lessons from the pandemic that we need to take into the current system. Why did the child tax credit, what is the appeal of the child tax credit? I think when I look at the way the CTC was adopted during the American Rescue Plan, it functioned basically like a cash transfer, right? And it's not a surprise that if you give people cash, poverty levels go down, right? Like we saw with SNAP and CTC, just the SNAP and CTC piece of it actually reduced poverty by 50% almost within 1 year, right? So how do we take some lessons from that and apply it to the world as we know it today, right? Maybe we're post-pandemic to some extent, but there's a real crisis going on in people's lives every day. And how do we understand that, the fact that we've made it so difficult for people to access, what we think of as the safety net? This is where the government has to come in, right? How do we make it easier for people to do that? And what you said, Dave, that there's a shift away from, over the last few decades, a shift away from providing help to the non-working poor to providing help to the working poor. That is absolutely true in the data, right? Like all of our programs, the current structure of the child tax credit is geared towards families who have some earned income, who meet some earned income requirements. If we look at the EITC, like the earned income tax credit, again, conditional on work. SNAP is not conditional on work, except when you have, if you're an able-bodied adult without dependents. But, a lot of the programs, the shift, TANF is, cash welfare. But again, we require people to put in like 20 hours of either meeting some training requirement or searching for work, or, something. So there's some connection to work. And, to me, it's always like, well, that's all great and good because you can support people who already have work or who are already, searching for work. But what do you do with the people who are really struggling, right? Isn't that the real role of the social safety net? And if we don't fix problems that happen at that period of time, then you're going to get worse outcomes in the long run. And this is not just true for health, it's also true for, socioeconomic outcomes, for education, which then leads to the spiral of, okay, now it's going to get, you're going to face all these struggles throughout your life because you did not get the support you needed at the time you needed it. So I've actually been sort of exploring this idea about how do we meet this conservative concern around work disincentives that would be associated with pure cash transfers that are not targeted and that are being, given to everybody with sort of this idea that you should get the help that you need at the time you need it, right? And so what I'm exploring is what I call this idea of a one-stop shop, also combined with a direct cash transfer. So let's say you lose your job, right? There should be a period of time, maybe it's 2 months, maybe it's 1 month, where the government just literally says, okay, all you need to do is check the box. I lost my job, I'm facing this crisis. Here's your cash support, right? That should not be the period where you struggle and you say, okay, now which programs do I need to apply to? I'm already worried about the fact that I can't feed my family, or I don't have a job, or I don't have healthcare. How do you alleviate that? Well, you can give people, immediate cash support. But then at the same time, can we figure out a system where if someone applies for, help through SNAP, they automatically also then are told, okay, these are all the other benefit programs that you also qualify, right? Like technologically, that's not a challenge. A lot of states are doing it. A lot of countries are doing it. To me, it's a little bit more about intent, right? Do we want to make it a little bit harder for people to get the help they need because we worry?
States want to make it harder?
Yeah. And so that's the analysis we tried to do. We said, well, do we see variations across states? Are some states trying to make it easier? And it's absolutely true. Some states will have online platforms where you put in your information, and a lot of the work happens at the back end, right? Some department gets your application and they say, okay, check the box for SNAP. Another department gets it, check the box for housing vouchers. But why can't we do that at a federal level, right? Why don't we allow a system where, Oh, sorry. And so let me stop there. Let's just engage in a
I
conversation.
guess just to follow up that, public school broker, colleges. I think all the people in these rooms would agree, looking at your, chart there, like, yeah, good, these are good things, we should do them. And yet the programs that we did provide during the pandemic are largely expiring, already returned back up. I think, if there's, as an economist, how do you make the argument?
Yeah.
Particularly, a political window here in DC is 2, 4, maybe 6 years. It's usually 2 years. I can't get a return on investment in 2 years, and CDO won't score because it's outside the 10-year window, right? I mean, how do you make that argument? The second question is sort of mixed in health and clinical
economics.
care, and I think it probably does a disservice to, in some ways, to link them, because the clinical care system functions if you can access it quite well, right? But our social welfare system
do not work,
right?
exactly.
Which leads to all of our crappy healthcare outcomes for the most part. So how do you separate where politically attracted to do that and yet link them when it's politically attractive?
Sure. Let's just have a conversation, because the only thing I would say on the budget window piece is that you have to do cost modeling. So that's the next step of what we're trying to do.
Can you get it in 10 years? Can you show
You can, because it'll depend upon if we have a window of 2 months where you're providing cash transfers, do people not take up then the traditional safety net? So you do get a savings somewhere, right? And you could make it that, well, you're not allowed to apply for these 10 different programs, which might lead to some cost reduction.
But maybe the other part of it is actually be bold enough to say, as what we were just to do, what if we could change what the OMB is actually counting and accounting for, if we believe in intergenerational health, so that it goes to a 50-year window rather than a 10-year window, and improves and is accountable not just for fiscal neutrality, but
I think
also
they
the
do that over
improvement of
30
well-being.
years, but in the short term, they will not do it, and the politicians will not pay attention to anything beyond 10 years unless it's to their advantage.
So I guess picking up that question, and this is probably for you, Aparna. I mean, you worked at AEI.
Yeah.
You worked in the White House, under President Trump.
Yeah.
Asking, like, what is the conservative case for these policies? Like, what has been most resonant in your?
The most resonant piece has been the pro-family piece and the pro-work piece. If you can combine the two. If you can combine the two, which is what we did with the paid family and medical leave stuff, right? And we had like Romney, and it's not to say that there's a huge amount of progress, but the fact that you can at least align with their values to say, well, why would you be against it, right? This is a pro-work policy. We're not saying women have to be out of the workforce for 8 months. We're saying, 6 weeks, 8 weeks, get them the support they need then, and then they'll be back in the workforce. And secondly, it's also pro-family. And you can see that with the child tax credit too, right? Like a few Republican senators and a few states also that are saying, well, can we experiment with an expanded CDC, something that's not just about work requirements, but, actually provides. And it's interesting that the CTC has been one of those policies that there has been support on, even with Republicans who are hesitant to do, like they won't call it paid family and medical leave. But if you say, okay, the child tax credit, and maybe we allow families to access it in advance and we expand the size, could that be something they use for paid leave? Yeah, they'll be like, yes, okay, that's something we can do.
It is time to migrate to shift.
Thank you so much for being here.
So I'm Sue Pullis. I oversee the health wellness of the League of Cities. And I've been in NLC almost 7 years and started Cities of Opportunity really through a recognition that when I was talking to mayors and city leaders, when we asked them what the major health issues they were trying to solve in their community, they said there's not one, there's many, right? And we really need more of a process, a framework to support them through that. So that's where Cities of Opportunity was born, with the idea that we have to meet cities where they are, right? It's not where we want them to be or where we think they should be, it's where they are. And so the initiative is really designed to help the cities build and strengthen their capacity, right? Whether that's partnerships, internal alignment across the agencies, financing, data, et cetera. We really try to help them build off their strengths and assets and understanding really what they're trying to accomplish and for who initially, right? It's a long-term proposition. So I'm gonna not talk the whole time because I want to make it conversational. That's what we were kind of asked to do, try to keep it a conversation. So I'd love to respond to questions instead of talking at you the whole time. So questions so far, or anything that you see here, a bullet that you're like, I want to know more about that. Yes.
About the how long we live, how well we live question. Is that something that you found that cities sort of are pondering and think is important?
We started the work really with mindset shift, right? How are we going to talk to mayors and city leaders about social determinants of health? How would we do that? And so really we had to kind of translate it to something that could be meaningful to them, something that could really help spur their work, right? So when we said how long we live, how well we live, that was sort of a seminal question for them that really took them to the data, right? Like, where are the life expectancy disparities in my city? And that shouldn't be happening in my city. That was really a call to action around that initial framework.
And was that powerful? I guess that's what I'm asking is, did people say, oh yeah.
It wasn't really like that exactly, right? It was like, are people raising their hands? Because everything we do through the initiative is through competitive application process. So we didn't know, like, is anyone coming, right? But we haven't had a cohort that hasn't reached its max capacity since the time we launched it. So it's also word of mouth, right? When a city's part of the initiative, like Houston, who was part of our initiative last year, they were like, well, we were referred by another city, right? So it's the peer-to-peer piece of it too. So it's not like it's a seminal question that we're throwing out to cities, right? Like, we did a lot of initial sort of translation and bringing them into the work with the support of the mayors who wanted to improve health of their communities.
Opportunity to think across these different initiatives. I'd love to focus on strengthening capacity and the idea that it's really about an ongoing process. What we're experiencing is that the big challenge is moving from these cycles of short-term self-interest, which election cycles, you could say, are part of that, or quarterly earnings. How have you found, like, sort of moving communities, or in this case, cities, toward the long-term shared interest, like breaking out of those short-term self-interested silos? Yeah.
So we meet the cities where they are, they apply, right? They're applying to be part of a cohort with other peer cities, right? So we're not saying you must do this or that, right? We're saying what's the issue, or what are some issues that you're thinking about, right? And so really we help them kind of like paralleling off of this, like asking the questions, right? So I'll give you an example. Tacoma, Washington. They came into our Mayor's Institute cohort last year, really fit with another 5 cities, trying to really address economic opportunity and health. And they already had this very robust anchor institution partnership put together, but the anchor institution partnership was not mobilized. Like, what are we going to do together, right? And so they started with a premise like, we should have more livable wage jobs in Tacoma. And they asked, well, what is a livable wage in Tacoma? No one knew. So we have a data partner embedded in the work, and we did the analysis for the cities. We're the data partner, not myself, and answered the question that it's $24 an hour for a livable wage in Tacoma. And then they asked, what are the jobs that can meet that standard? And lo and behold, it was the healthcare sector, because of all the changes through COVID, right? We lost a lot of our healthcare workers through COVID. So then the city had the anchor institution partnership. They had the health system at the table. Some, the local community engaged in this question about, now, what do we do? So they structured what they call an earn and learn pilot. And so it's a collaboration that, in talking with the community about what they would need to be successful in the program, doesn't just offer job training, right, to get a healthcare sector job, provides housing supports, a stipend, and then other reference supports and services. So now they've been leading that pilot work, and it's now helped them forge the next question, which now they're working on childcare, because it's like, well, we want to get people in the workforce. How are we going to solve the gaps in childcare? So now that's their next initiative. So once they got sort of working together and mobilized, they could sort of fashion like, okay, now what else is it going to take, right? So it's really the question with the data. And city leaders don't run for office because they want to use data, right? They run for office because they want to solve issues. But the data capacity gap is pretty enormous in small and mid-sized cities, as well as trying to get them to work across, right? Because it's not one agency that's going to solve that livable wage job, right? It's several. So the housing department, the health department, the mayor's office, right? It took that connecting the dots toward something they could all agree that would be a benefit to all of them.
Childcare or stipends for living and expenses, is it the employer, or is the city doing it, or is it a partnership?
Well, so the Learn pilot was a collaboration between the city and county. We owe dollars, ARPA dollars, HUD vouchers. So in that example, right, they're kind of trying to work across their assets and so forth. So if I understand your question, you're sort of saying broader, right, child. I think that's what they've tried to build now, with some intentionality toward a policy change to bring that more stable childhood need right to bear. So it's really a policy campaign that they're in the process of launching, because it's what's needed is not in place.
People get into the program. What if you have so many slots? What if it's oversubscribed?
So it's a competitive application process. So and cities choose their level of readiness. We have the action cohort, which is up to 8 cities for 15 months. We have a Mayor's Institute cohort that works at a very explicit intersection. So the one we're about to launch is community resiliency and health, looking at infrastructure, the built environment, and planning and zoning. So 6 cities applied. We have 6 cities in that cohort. So sometimes, like with the Mayor's Institute on opioids, we had 23 applications. We had to turn cities away in that instance, but really tried to keep them together as a learning community where cities could share their progress. So we can't always accommodate the need or the demand. So it's action cohort, Mayor's Institute. Then we have a community of practice structure that really tries to meet the cities where they're at in terms of, I want to know more about data, right? Or I want to talk to my peers about how they're financing, right? So we're bringing them together, and we can accommodate up to 12 cities in that community of practice. And then we have a baseline entry point, any city, anywhere, which is called the Peer Learning Lab, which is really just giving the cities a platform to share the progress that they've made and how they've done it. So, so hopefully that answers your questions, but we had to structure the initiative to meet the cities where they're at based on level of readiness and their capacity to be part of a cohort. Some cities don't have the capacity to stay with us for 18 months, right? So they might just join a community of practice.
Question of this morning, holding a big, bold vision for transformative change and the importance of meeting cities and communities where they are. And I'm curious, when you look at kind of change over time in the places that you work with, the extent to which you see folks addressing increasingly systemic issues through their initiatives and projects.
Yeah, this launched as a pilot, so it's still pretty early, right? Although we feel like we've had some really sustained success, right? Like the Tacoma example, right now they're working together toward another end. Houston really came to the work, trying to figure out how they could have a more equitable process for green stormwater investment. And so in that case, it was really helping the city work across their public works department, their health department, right? The mayor's office coming together around what could that look like, right? And Carol Haddock, who's the director of public works, was like, I'm an engineer. I never thought about the people that would actually use the pipes or the water, how you would get more equity, right? So they designed an equitable decision-making process that they've now been able to use on other city issues. So when we say strengthen capacity, it's not about an individual. We try to be 5 deep. So we're working across city agencies. So even when there is a mayoral change or a city council member change, we've got enough working partnerships that can sustain, right, the change. So that's the idea. It does not always work. There are always exceptions where people, you know, feel like, okay, we really know what we disagree about, right? Yeah, you know, I think that's part of the, right, but that's part of the solution because they've been in a conversation and they can see each other's perspective. So sometimes that's the transformation, right? Sometimes it's mindset shift. It really is meeting the cities where they're at, right?
Are there any examples that come to mind of initiatives that elected officials have participated in and then used in their reelection campaigns?
You know, I have to admit, that's a great question. I'm gonna run re-election since we have to be sort of agnostic about it. But that's a great question that I could ask. I'd have to think probably because like Mayor Turner in Houston, he was in our Mayor's Institute cohort back in 2018, one of our early cohorts. And, you know, he feels like his vision for the city is now being met. So I'm sure he probably used that when he was running for re-election, but I should ask because I don't know that for sure. It's a great question.
You're making the big it makes sense. Well, as you look at this great work that Dave did.
Yeah, we just we built so to answer your question, I totally just lost my train of thought. So you were saying, how do we get them sharing? So it's, yeah, so we have a solution for it. It's an event that we do here in DC. We had about 500 people virtually and online to give the cities a platform to talk about their work. But now we're also trying to put more into the literature. You know, that's sort of the next step.
Okay, so we're going to spend a little bit of time walking through some case examples of the work that the Law Center has done and sort of the approach that we have in doing this work. So Dorian Mason, she, her, hers, Director of Health Equity at the National Women's Law Center. And really the work that I do is making very concrete connections between economic policies and their impact on health. So we are a multi-issue organization. We work on all of the things that you think of when you think about what economic stability actually means to people in this country. So we're talking about the child tax credit. We're talking about how much childcare costs, generally speaking. We're talking about housing assistance. We're talking about nutritional assistance. We're talking about all the things that really stabilize someone's life and allow them to have not just access to like health care, right, and health coverage, but access to good health broadly. And so the crux of my conversation and hopefully talk today is really about how important it is to make those very concrete ties in spaces where people are primarily talking about economic policies. So what happens many times is that we are the organization in the room that is bringing that health perspective. So if we're talking about housing assistance, and I'll walk through some examples that we have on the federal level about some good legislation that's passed. But we tend to be the only ones who are saying, oh, and here are the health consequences of this particular piece of legislation and why it's important. And so it's incredibly crucial to have voices in the room that are bringing that perspective in addition to just the broad, you know, stabilizing economic force that some of these pieces of legislation have, but really bringing that health framework. What we found is that, you know, depending upon the room and the audience, both in coalition and with legislators, that we need different messaging, right? So like the same argument is not going to work for every person. So there are some economic arguments that are very persuasive, but sometimes that health hook is actually what brings someone to the table, right? And so ensuring that health hook is there, even when we're talking about the child tax credit or we're talking about access to childcare, if we are saying that because the cost is so high to be able to provide care for children or elderly people, that household now cannot, buy healthy groceries, that household cannot pay for co-payments, that household cannot pay for prescription, medication that they need. And in turn, it exacerbates health outcomes or negative health outcomes and costs both that individual, that hospital, that state, that federal government more money on the back end, right? So it's an argument about where the investment occurs. Is that investment going to occur at the front end, right? By stabilizing people's lives, that by ensuring that they have access to good health, or is that investment going to come on the back end when the harm has already occurred? And most of the work that is done at the policy level, at the federal level, I should say, focuses on harm has already occurred. What do we do to, now address that harm? And so it's really important for people who are in like the data-driven health world to be in these spaces to provide that perspective. So I'm just going to quickly go over some examples that occurred in the coronavirus response legislation, and then I'd love to open it up for comments and questions. Well, actually, I should say one more thing, and then I'll talk about the mental health impact of economic instability, which I think is something that does not get talked about nearly enough, and particularly important because we are right now in a mental health sort of crisis in our nation. And if we are really trying to address that, that means addressing the forces that make people's lives economically unstable. Okay, so the first, let's talk through some examples from our current coronavirus, because that tells us what is possible, right? Don't ever let anyone say that something is not possible, because we've already had it happen. So the first is the child tax credit, which we are still working. I think someone else is talking about it as well. We are working to, fully incorporate and be sustainable and actually exist. But we also had unemployment insurance that was built up, right? So we had $300 a week for people who were out of work, that allowed them to, again, allocate resources in a different way than if they were without income and without that support. We also had paid leave. We had tax incentives for employers to pick up paid leave. When we're talking about health, it's not just like, again, if that person has coverage, it's if they have coverage, do they have childcare when they need to go to seek out their own health care? Or do they have paid leave where they're able to go seek out care without feeling like their job is threatened, right? So it's all these other institutions and policies that can be built up in order for people to be able to truly access good care. We also had childcare funding. We had like $39 billion that was awarded for childcare and direct funding and stabilization fund, and also through some block grants. We had
Hello, this is Bobby.
Oh.
Hold on 1 second.
Oh yes, I was curious.
We also had housing and utility assistance. And at that, since we already have some questions, ultimately, we also want to be very clear as people who are working in the space to make the ties between having economic instability and the impact it has on people's mental health, and particularly even potentially children's mental health when we're talking about sort of stress around not being able to afford basic necessities. And we have a mental health report, I'm going to plug it, coming out soon, that talks about even though it's not causal, but the proportion of people who are experiencing economic instability, who also are experiencing symptoms of depression and anxiety. So yeah, I'm happy to take any questions that you all have.
Jen, I don't know if you're on now, but Jen had a question that might come through there.
Okay, great.
Hi, Dorianne. I was wondering, you talked about the importance of making investments we have long-term savings, but I was wondering if you could talk about how you address the wrong pockets problem, where the agency making the investment is not the agency getting those budgetary savings in the long term.
Oof. So that is not an issue that we have dealt with directly. But if hypothetically, if we were to address something like that, I think it would be first sort of an education campaign, because that may not be something that most people understand is happening. And then we would look to the experts who are the ones who actually know about how those, payment structures and where the money is flowing. We would look to them for guidance as to like what the actual proposed solution is. I will say that engaging in this space, like health is so many things that like you can't be an expert in everything. And so another important thing to mention is that, you are bringing in the people who have the experiences, whether that's lived experiences of people who are experiencing poverty, or have, be it health experts that understand that there is a problem with where funding is happening versus where it should be originating, right? So we would just defer, but I haven't actually worked on that directly. Sorry.
Thank you.
Yeah. Mm. Yes, that's a great question. So I would start with, we heard earlier the importance of that narrative change, and the biggest combatant to that is to expand people's perspective of what health is, because most people are not thinking about health in terms of economic security. They're not thinking about health in terms of environmentalism. They're not thinking about health in terms of paid leave, even though all of those things are such drivers of health. And so for me, the foundational issue is really changing the narrative and expanding what people view as health and kind of making everything health. We talked about this a little bit in our small group, is that the way that I position the work that the Law Center does is that everything is health and everything is economic, right? So like I am making those ties no matter what the issue is. And I think that is where, as advocates, we need to go, is to make everything relevant, to make everything concretely tied to the different issues. So that's the first thing. The second thing, though, is what you said, is that there are, everyone has an interest. There are people making a lot of money based on the way that our system is set up. And so it is inevitable that you're going to get pushback from people who stand what they believe to lose money. So I think there are a couple different things that you can do. One, I think it's important to educate again the public about what a good investment actually is, right? So most people don't know how much is being spent on the back end of healthcare versus what a good investment on the front end could save. And so I think that the more people know about that, the more voices that legislators are hearing that are encouraging investments on the front end too, again. And then the second is that, like, and I am not typically one of those people that's like, you can engage anyone, but like until we go to a system where there is no capitalism at all involved in our healthcare, then there are ways to incentivize good care that allows people to still engage and, without necessarily engaging where they're engaging, if that makes sense. So like to think through, how to engage payers, how to engage healthcare systems in a way that doesn't necessarily isolate them, but that like puts value and like outcomes at the forefront, which may mean an investment at a different point in the process. But I don't know exactly. Right. Mm-hmm. Honestly, that feels like we don't even need to get there, because the type of work that is being invested in at the back end, that work is always going to exist, right? So it's not necessarily a shift in like fewer people in that space. It's a shift of how much money is being allocated in that space. And so I don't know. I'd say no to an idea. So, right, a just transition may be a path forward. But I don't, at least in our advocacy, we're not even there yet. It's just more so getting people to understand that it is a better investment on the front end versus the back end. And then we can think through what that means for potentially a change in workforce. But I don't necessarily envision that it would be so stark a transition of where doctors are or what they're doing that we would necessarily need to like think through what else they could do. But yeah. Oh. Yeah. So it's right for just potentially a different type of investment. I think because health is at the forefront of their minds in a way that I don't think that it necessarily has been in the past 10 years. Maybe, right? Maybe. Oh. Yeah.
Michelle, can you hear us by chance? I want to make sure you had a chance to ask your question.
Thank you. Yes, now I can hear you. I couldn't hear anything for a minute. So in how to shift the perspective from a reactive to a proactive approach to care, as reframing people need saving and support versus like society actually owes the people that are born and kind of trapped within it the investment to achieve what is expected of them. Like if we expect people to be productive members of society, shouldn't we be showing that we want to invest in their ability to do that in the first place?
Yeah, I mean, that feels like a comment more than a question, and I 100% agree. I think that in the last session when we were in our smaller groups, we talked about what are those narratives that need to shift. And a part of that is like really framing out some of these issues as like an opportunity, right? So an opportunity for everyone to have their needs met and to be able to meet the needs of their communities. And so I think that is a part of that, right? Is not just like, yes, we should do this, but also like, we do have expectations of people in society, and we want them to have the tools to be able to meet those expectations.
Also with health services, working on systemic efforts to reduce poverty and get to health equity, economic equity, racial equity, you name it. So now I'm going to pass it off to Lori.
So the story around this body farm is kind of long, so I'll try to keep it short. But basically, we're balancing our budget on the back of most. And so there was a situation. Governor Inslee created a response to a lot of advocacy around the issue and greater accountability to poverty reduction and reducing inequality. So the poverty reduction work was 2018, and that first group was a lot of different folks, legislators, agencies, employers, a lot of folks who didn't necessarily. Sorry, my voice does not carry. And we did two things well in that first meeting. We thought a lot about how efforts had failed in the past to address these issues. We knew that we were not the only group to take this on. And what we needed to do was these first two things. structural racism and center racial equity in everything we did. And we were closest to the pain, who we knew were also closest to the solution. So we raised a bunch of philanthropic money. We were able to get some really great consultants in to help us with the work. We also passed through money to a community action partner who convened our steering committee of people experiencing poverty who had lived expertise. So they met monthly, we met monthly. They had co-chairs that sat on the general work group as well. We spent a lot of time together over the course of 2 years to craft what became the 10-year plan to dismantle poverty and inequality in Washington state. And we submitted that plan in January of 2021. And as a result of both mostly the way in which we did the work, which is meaning we centered people with lived experience, they had the ability to set the priorities for the plan and also final approval over it. If we didn't get things right, they let us know. We tried to fix it. So we had a plan that everybody could get behind. And as a result of that, since January of 2021, when we submitted, 70 policy program and funding actions have been taken legislatively in healthcare, in childcare, in tax policy. We also have a bill now that mandates the inclusion of people with lived experience in policy program and funding decisions. Every agency has to do that, and we compensate them as the experts that they are. So I'm going to stop there and let Jennifer talk about the rules.
So I was part of the core group of folks who met monthly, and we met for about 4 hours a month. And we were able to then build a relationship with each other. So initially, my personal experience with government agencies, much of it being I'm a client, they are, it's more of a business transactional type of deal. It didn't really, initially, I was very apprehensive. I wasn't sure of the intention. I wasn't sure what was the outcome, and what was my real role in this work. Was I just going to be telling them things and they would pick and choose what they wanted, or was I really going to have a leadership role, a partnership, a co-collaborator work? And that's what we shifted to. I think in terms of the way the system has been built and structured is, the government is the experts, and we as people in poverty or lived experiences, we didn't have the value or the ideas of that we could bring the solutions to these policy issues. But that changed with this group, and it created a mindset change within the government agencies, because the government system is built to do exactly what it's done, which is kept me 6 generations in poverty, 38 years, my life in poverty. Poverty is a systemic problem. It's not that I made bad choices or that it was a personal choice. Nobody chooses to live in poverty for the rest of their life, and nobody wants their children or their grandchildren to live in poverty. And so for me, poverty is preventable, and that is possible with policy changes. But in order to have those changes, we have to understand that we, the people who are at the bottom here, on the ground, who are experiencing all of these policy gaps and program issues, we know what you guys need to fix your system. And actually, it's not even fixing the current system, but rebuilding the system into a new system that's going to basically lift all of us up. So in my community, we're told to yahout, to push forward together, that it can only be completed together. And so in order for us to do that, we have to understand that us as people in poverty, we have the solutions that everybody needs, but we have to also recognize that we need to be in that same collaborative power and leadership, because it can't be a transaction. There has to be relational accountability. There has to be partnership and build of trust, and understand that that our lived experiences have value, and that if we can take those experiences and create generational change, then we have to do that together.
So in your attendee packet, there will be the 70 policy and program funding actions. That is not comprehensive. It's just what we've tracked to date. So this work is iterative in nature, as we know, the face of struggling Washingtonian shifts. So we are always working in partnership with our steering committee, and this work shelved the us versus them. It's a we. Jennifer's my colleague. I can text her, she can text me, and it's really it's been a profound experience to work on all of this with so many dedicated individuals from the government side, from the community side, business, philanthropy, think tanks, you name it. Like you said, it takes all of us. All right, what questions do you have? Yes.
Well, so many of these things cost money. And so what goes on in Washington State, what have the budget implications have been? What is the receptivity of the legislature for putting the money where the policy issues are?
So regressive, yes. We have a sales tax, we don't have an income tax, we have a number of other issues with a very outdated tax system that was built for a 1930s economy and not the current one. So there's tons of efforts on that side. So two of the successes that have happened in the last few years, we passed a state earned income tax credit called the Working Families Tax Credit that models itself off of the federal EITC. We were one of a few states that didn't have that. We also passed a capital gains tax, another tax that was not, that a lot of other states have that we didn't have in Washington, which freed up a lot of additional revenue. We also have now a carbon tax. It's a cap and invest tax, but that's another source of revenue with a dedicated purpose. But that's happened in the last 2 years. So we have more revenue from that. We also have a very favorable economy where a lot of additional revenue is coming in, and then we used our dollars from the feds during COVID very wisely, and we did like a targeted universal approach where we really tried to push those dollars to people in communities that have been historically excluded from well-being. Now those dollars are drying up now, right? So we will only get so far in our current structure. There's other things that we can do, but we are having the tax conversation alongside this conversation. There's a wealth tax bill in the ledge right now. Depends on the tax. The Working Families Tax Credit passed with bipartisan support. It generally, historically, has been a tax credit. Generally, tax credits have like bipartisan support. So that was kind of an easy one. However, I mean, Washington does have favorable politics compared to a lot of other states. And while we are a purple state, there's a lot of, we have an east side, west side dynamic going on. Our politics were favorable definitely to pursuing some of these policies. That said, to have 70 policy program and funding decisions, like we have built political will. And we've done it because we have constituents from all over the state that are a part of these districts that show up with us. And when people show up with you, it's just much harder to judge them. So
became humanized in both sides of the aisle. It's really hard to look me in the eye after hearing my story and not have some sort of a connection and understanding that what's happening to me could very well happen to them. And I've always said, poverty can happen to anyone. Like when we saw with the COVID pandemic, like the amount of people who were just above poverty were now in poverty. And so I think it really opened up the eyes of everyone to see we do have some problems in our policy structure and we need to help everyone.
So Washington State has a lot of really robust existing programming at a state and county level, and certainly existing community-led efforts. And this is a question about, it's one thing to think about integrating strategies to fresh new work where you
are coming in and you really have an opportunity to shape things from the ground up. And it's also a different thing to think about what it looks like to shift existing work to align with this really important work. So I'm wondering if you can speak a little bit about what it's actually looked like and how you've navigated thinking about integrating all of these things into, the robust work and programming that already is underway across the state.
Great question. So a lot of what's in here, we didn't try to reinvent the wheel. So we looked to a lot of the great efforts that were happening in Washington. And while we were working with our steering committee members, and they knew a lot of them too, but we pulled in a lot of community partners from around the state to learn what they were doing, and that is reflected in the policies. So we didn't try to replace that. We just tried to build off of all of the great work that was happening, and we added a lot of new as well. And now we're being asked increasingly, because we're with DSHS, we host the work, but we work with all these different agencies. Our State Board of Health, our Department of Health, they recognize all of this is social determinants. It's just a different framework. We're all doing the same thing. The environmental justice community, they're like, hey, can we partner? Because this is going to lead to better health and well-being. So we're not there yet. Our infrastructure of breaking down those silos, which is like the, classic problem, right? But we are starting to liberate ourselves from bureaucracy. And it's mid-level staff that are doing it and showing leaders that it's possible.
And I think if you want to come and ask your question, I think Lori and Jennifer and Lindsay are all ready for it.
Okay, thanks. Thank you for this great presentation. I just had a quick question. We, at my organization I work at, we also prioritize elevating the voice of those with lived experiences. We work with a lot of family and resident leaders. We also pay them stipends to be involved in our work. A lot of people come to us because we have this special, like we call it, secret sauce in our work. And so while we're already feeling like we do this work well, we're also always trying to find more people to bring to the table. And so just curious how you all recruited and identified the right people to come to the table to bring that lived experience.
Yeah. Oh gosh, we're being called back. So can we answer your question? Well, I guess, can we do time, Fisher? Okay, so, we're gonna answer your question when we come to the big room. We're going back.
We are going to hear a bit about what's turning in your minds based upon the morning, specifically the showcases. So we're going to do that for 15 minutes, and then we're going to head to lunch. So we'll tee up lunch in about 12 minutes from now. So the way we want to do this is we want to hear about like what ideas are turning for you, maybe what questions you're noodling on. I know we have at least one question that came up that they weren't able to get to in the small group conversation. We'll make sure we get to that one as well. We're going to kick it off though with a few people. One of whom we already met. So Anita Chandra is going to start, going to be with us. We also have Bob Kaplan, who is adjunct professor at Stanford in the University of Medicine. And then we may get Mac if he makes it back in the room. Oh, Mac, you made it back. I'm going to give you my mic. That's what we're going to do. Okay, so are you, Bob, you want to kick us off? Again, we have a little time for some brief observations.
Sure.
I thought it was on. You just turn it back up. Yep, there it is. That's great.
There we go. Is this on? Can you hear it?
Yeah, it is.
Yeah.
We can hear you.
Well, first of all, thanks for having me. And I just want to make a couple observations, and they're about this whole notion of how do we quantify some of these ideas, and how do we need new ways of thinking about them. And so in sort of preparation for coming here, I was thinking about some of these ideas, and it goes back to a report that I did for a conference that NATO sponsored about 43 years ago. And in that, I wrote a paper which is published someplace, which I just rediscovered as I was moving and trying to get rid of old stuff. And since this is a paper that was published in an obscure place and no one's ever read it, it's never been cited, I thought it's okay to bring it up again, but to try to update it. And it was about this problem of gun violence, and that I started thinking about, well, how do we quantify the impact of gun violence? And we do that primarily by using metrics about deaths. And as we looked at this, we realized that although every death is extremely important, they actually are, I think, a small component of the problem of firearm violence. And so in order to sort of get our arms around that, we tried to look at the quality adjusted life years associated with having too many guns out there. By the way, when this was done in 1981, there were about 1/10 the number of guns that are out there in the U.S. in comparison to then. But back then, all of our NATO colleagues were saying, "Well, you guys in the United States are nuts. You've got way too many firearms." And so we tried to look at, well, what are the additional impacts of having too many guns out there in relation to deaths and disabilities and injuries? So we tried to estimate the quality of life loss and the number of people who actually modify activities of daily living because there are too many guns out there. And we made this estimate, which was about, say, maybe 0.03 units on a 0 to 1 scale. So not very much, but something. But it's multiplied by what we estimated at the time to be about 60% of the U.S. population makes some sort of modification to what they do because they're worried about being victimized. And by the way, it's significantly higher for disadvantaged groups. And so at the end of the day, we tried to then calculate the quality adjusted life years associated with having too many guns out there. And it turns out that there are lots of them, and I have the calculations, but I won't bore you with that. But then we estimated the cost per quality adjusted life year lost associated with the anxiety of being in a society where there are too many guns. And it turns out that it comes out to be about the same as screening people for hypertension, something that we very much agree we should do. So I guess the bottom line on this is that I think that we do need different ways of quantifying and thinking about the impact of some of the things that we do. By the way, I just want to mention that that when we look at various aspects of victimization, so kids, for example, that are killed on school grounds, it's actually not that many, although, again, I don't want to diminish that because it's extremely, that every one of those deaths is terrible, but it's about 300 some odd in the last year. But if you look at the impact of those occurring, it affects essentially every family that has a school-age kid in the country. So.
All right. Thank you for that way of thinking about the narrative, thinking about things differently. Matt McCullough, who is Associate Professor of Public Health at, I believe, Boise State University. We'll also love to hear sort of, what are you thinking, what are you noodling on based upon the morning so far?
Sure. Is this on? Yep. So one thing that has come to mind, and I wear the hat of an academic, so of course I'm going to put, try to put a framework on this and modify it, adapt it, and all that stuff. But I was thinking of translational research. Where we go from, we discover a new drug molecule, whatever, and then our framework is let's translate that out into practice so that everyone can have that at their next doctor's visit. There's also sort of an element of translational science that seems to be bubbling up in a lot of these discussions, which is translating things between different levels, right? So if there is a policy discussion, a values discussion being held at the 30,000 foot level, and there is also work being done by a mid-level bureaucrat in a nameless town, in a nameless state in America, how can we ensure that the progress made in one level can move to the next level, or moving both up and down? I don't know that I've seen a lot of, at least academic work that looks at expanding the impact of the social safety net and achieving better health through addressing the social determinants of health as needing to be translated from one level to another. So that might be an area where we can think and work, and academics could, put some thought into.
All right, thank you very much. And then Anita, and after that we're going to go to Fisher.
Great. Maybe connecting some of what Bob and Mac just said. I mean, I keep turning over the idea of the social contract and what we expect from each other today, what we expect communities to do for us, like what National League of Cities is doing, what we expect is happening in places like Washington State, and whether we have actually fully shaped that in a way that is effective, that is modern, that acknowledges our absolute shift in demography, our conversations about political power, obviously our conversations long overdue around structural racism. And so as we kind of reframe things like cash transfers that we just heard from Aparna, and we talk about what we used to talk about as safety net, is there a different way to reframe this whole thing going forward? And I don't know that we've had that part of the conversation. From a measurement perspective, we don't tend to measure our ambitions and our dreams. We tend to measure our deficits. And the question is how are those things going to connect going forward? What should I expect from you? What should you expect from me? What should I expect from the community that I live in? What should that community expect from me? That, to me, is part of the kind of the new health investment paradigm, but is also part of a kind of a new community paradigm. And I would venture to say, and I've been having this conversation with folks offline, is, we're not designed really for success in any of those areas. For those who study cities, that we know we kind of are designed in 1930s thinking in terms of how we organized our agencies and our departments, and then we've added stuff on top of it, but we've actually not modernized. And I wonder if, as people who care about the health and well-being piece of this, if we should be more central in those conversations in a different way and show up differently in spaces where we're talking about politics and social contract, and jump kind of feet first into that at this point versus kind of holding back and, occasionally writing on it, but actually doing that. The last thing I'll say is just to represent the kind of the industry that is health research in some ways, and I think we should call it that. What should be our new standards around the mechanisms for our recommendations? So when we put a conclusion at the end of a JAMA paper, what is our expectation and our responsibility in terms of the mechanisms of how that's actually going to situate in that social contract going forward? That should be part of standards and academic research going forward. So those are the two things I'm thinking about.
Thanks. Fisher.
I'm waiting to see if anybody online has a reflection or a comment or a question. There's a very specific question. Yeah.
We'd love to hear that one. And then if other folks come up, we will.
So that question in particular was about how organizations, groups are involving meaningfully people that have lived experience in the work that they're doing, and how to bring those people in, not just in a way that, says your involvement is important, but actually co-partners. And I think, Jennifer, you were talking very, very elegantly about what your initial doubts were about whether that was genuine invite or whether it was just another invite that you could respond to how you were going to respond to it. So that was one question, was how does that actually happen? What does it take to actually make that relationship develop in a meaningful, reciprocal way, that you're influencing each other and it's mutual and that. So that was one of the questions. There's a couple other things that have just come through. And does anybody online want to say for yourself what the
I think
what the
question is? We could respond to that.
Yeah, totally.
We already got some mics going over there.
Okay, perfect.
You want to collect up those other questions, and then we'll see if we can get back to those before lunch. But I don't know who from that crew would like to turn it back to the top and then give it a moment.
Can you hear me?
Yep.
Okay. I'll be brief and then I'll let Jennifer speak. But, one of the things that we did well in our work was recognizing that as an institution, Health and Human Services is not trusted and has caused a lot of trauma, and our agency specifically has caused a lot of trauma. So we were able to listen to the feedback we got without necessarily taking it personal, like it wasn't about me personally, but also taking personal responsibility that now I work for an agency and I need to do something about it. But what we did was contract with a community, very trusted community-based organization. We raised money for them. We passed that money through to them to convene our steering committee, knowing that they had greater trust, and that trust had to be brokered with the government agency. And so Jennifer and her colleagues, 22 of them, they kind of set the culture that they wanted us to enter into.
Thank you. Yes, so when I first entered the steering committee, I was very apprehensive about what were they going to extract from me? What was the intentions? Historically, coming from an indigenous community, I don't have a lot of trust with government agencies, and that is just by policy design. And so when we were working together, which is what we did, we met monthly, and we worked together to build a relationship and to build accountability amongst each other. I began to see that it wasn't just going to be words, like there was actual action coming from what they said they were going to do. It still took me, at least that first year to really start to build that trust and bring down that wall, because I wanted to be sure that the information and the experiences that I was sharing with them was actually going to create generational change for my son and my future grandchildren and all of the generations that aren't even here. For me, it's been empowering to go from being in this client type of business transaction to being co-collaborator and partner. And that's what's really important, is that we have people who are on the ground, who are closest to the problem, that have the solution that you all are seeking. But unless our voices are there and centered around in terms of leadership and policy development and reform, you're going to continue to have the same problems. And so in my community, we say yahout. And to yahout means to push forward together, that it can only be completed together. And so it's going to take every person on all levels of the community, and the fact that the agencies are all going to have to yahout together. And so with that, I thank you. I thank you for being here and having the very rich and mind-shifting discussions today. That is all.
So I would love to just lean into this conversation in this moment, like you're really saying the thing. And as a facilitator, I understand that lunch is a real thing. So here's what we're going to do. Dr. T is going to sort of have our last word, and then she's going to hand the mic back to me. Then I'm going to tee us up, no pun intended, for lunch, and then we're going to come back. So
I just want to say there's always a time in meetings like this where we have polite conversation, and then somebody sort of drops something into the conversation that's real. That just got dropped in this moment. I want to say, for the vantage point of those of us who are here and trying to have an authentic conversation, this trust conversation is huge. I think we have missed the opportunity to think about what's happened in our country with the fact that people don't trust each other. They don't trust us. We just saw that play out with the CDC, right, talking about what we needed to do. And people say, I don't trust you and your vaccine. I don't trust what you were talking about. I don't trust you, no matter who you are, right? When we can look at that scientifically, like the Pew Charitable Trust does these studies all the time, talk about our levels of trust. We don't have that sense of trust. And unless we're building that back as a first part of the walk, all of this conversation is meaningless. So often when I work with folks that are, working with the case made, the first thing I say to folks are, what's your trust walk look like? Because if I don't know what your trust walk looks like, I don't know that you're really serious about the work that we're doing. And that has to be central. I want us to have a conversation about what does the trust walk look like that precedes the stuff we're talking about. And related to that, right, if I don't know what your trust walk is, I don't know that I can trust you. But the other thing is I want to drop another mic in this conversation. All of this stuff that we've been talking about is really interesting. We get it. We sound really smart and intellectual. But for the folks who are at home, I don't trust this conversation. All of us are being paid to have polite conversations about in very academic terms. But for the folks who are at home, who are showing up to hospitals and not being able to get the care they deserve and getting bills in the mail they know they can't pay for, even for those folks who have health care, what is this going to do for them? How does this help me pay my rent? How does this help me take care of my kids? Like, that's a real conversation. And for folks who are listening to us, they will say, I don't trust you because you can't tell me the most basic things that are central to what I need. How do I pay the rent? How do I make sure my kids are safe? How do I make sure that my health is improved when I'm working 2 and 3 jobs at the same time and nobody gives a damn about that? And then you want to come and talk about polite conversation about how we get healthy and I'm working 3 jobs? Are you kidding me? So I want to have us, hopefully this is the opportunity to have a real conversation, first about what does a trust walk look like as professionals in this space who know that that needs to precede anything that happens that's real, number one. And 2, for real, how does any of this matter to the folks at home? They don't care about whether our bureaucracy works better. They don't care about whether our ARPA system, our dollars are given out better. They don't care about whether you can talk to you and your data systems align. Who cares? Who cares? Let's have that conversation today.
So I want everybody to get enough fuel over lunch to come back and be for real. Right? Let's get for real. So lunch is going to happen. You just walked past where the food was. Kristen was standing near there to make sure that you didn't get confused about what timing it was. So you can go back to where the lunch was. We will reconvene here at 1. We're going to start at 1:30. It'd be nice to reconvene at 1:29 so we can get started right at 1:30. We're going to take a look at our agenda and make sure that we can get into the for real as quickly as possible when you come back. So I hope that you make it back here at 1:29 so we can get both for real at 1:30. Thank you so much. See you back here then.